This is Dr. Chris Robertson providing an overview of influenza, which is an acute self-limited febrile infection of influenza types A and B. There are other types, however, A and B are most common, what we most commonly test for and treat. With presentation of these patients, you want to make sure that you're evaluating for systemic symptoms, cough, patients who are not at their usual level of activity and may be confined to bed. Subjective patients will report fever, chills, sweats, anorexia, malaise, myalgia, and arthralgia. Objective findings on physical exam can be nonspecific. You want to make sure that you exclude complications, particularly otitis media, sinusitis, tracheobronchitis, as well as pneumonia. Keep in mind in your older adults, you may have complications that require hospitalizations. This may be a more likely scenario in your older adult or elderly population. From a diagnostic perspective, influenza is based on clinical findings. Viral culture is the gold standard. However, it's limited use in practice given the time that it takes the culture to result. In practice, what you'll see used from a diagnostic standpoint is the rapid ELISA antigen test. Other diagnostics do include the nasopharyngeal swab. You may see a CBC done, which can be normal, or you may see some decrease in white blood cells, leukopenia. When you see leukocytosis, that is an indication that there may be bacterial complications. With regards to chest x-ray, you're typically not going to do a chest x-ray unless you suspect pneumonia or some other type of complication. With regards to treatment, it is based on symptoms. So if there are nasopharynx symptoms or nasopharyngeal symptoms, you may be looking at recommending saline nasal spray, types of gargles, antipyretics, analgesics, particularly if there is fever and myalgia. Also looking at a cool mist humidifier. When it comes to medications, you want to make sure that or antiviral medications, those need to be prescribed within the first 48 hours. These typically lessen the severity of symptoms as well as the duration of the illness. Patient education revolves around droplet precaution, hand hygiene, smoking cessation if it's applicable, making sure patients stay hydrated, and also encouraging annual immunization from a prevention standpoint. With respect to follow-up and referral in mild cases, there's typically none. In moderate to severe cases, you typically want to make sure that you follow up until symptoms resolve or until any type of complications or sequelae resolve as well. And that concludes our overview of influenza.